And again, like I grew up in a culture where braces were not a thing. And I feel like every kid I know here in the US has had braces at some point. What are some of the indications for kids getting braces? And at what age do we actually start looking at that, their dentition to decide whether or not to proceed with orthodontics?
I'm able to see even in toddler phase if I can anticipate that braces may be needed in the future. We don't typically intervene that young. Typically, first orthodontic consultation is at 7 years old. There may be occasions where we refer a little bit earlier to the orthodontist, but typically the first orthodontic consultation would be at 7 years old. Kiddos who start braces or any sort of orthodontic therapy at 7 years old have specific issues that would require phase one of orthodontic therapy. So those kiddos typically would need two phases of therapy. They get, an expander or some other type of appliance to correct a more severe issue that has to be corrected while they're still growing. Because if those kiddos wait until they're teenagers, we're not able to modify growth because they've done a lot of growing already. So those would be kiddos who have underbites or anterior cross bites. If we don't intervene early with an orthodontist and using appliances to modify growth, then it's more likely going to be a surgical intervention when they're teenagers. There are cross bites where the bottom teeth overlap the top teeth in the back as well. A lot of children who use a pacifier or who are thumb suckers, they narrow their palate. And so the palate has to be expanded, and that also has to be in an earlier age when kids are still growing. And if we wait till teenage years, we're not able to expand the palate at that point. So your dentist will be able to tell you if there's anything that needs early intervention and orthodontic consultation at an earlier age. If it's just minor crowding, a lot of times that can wait until permanent teeth are all in, and so into the teenage years. So it really depends on how severe the issue
Got
is.
it. You shared with me about having dental sealants for these pre-teenage kiddos. What is the advantage of having those, and what are they actually?
Sure. So a dental sealant is a white material that we would flow into the grooves of permanent molars to prevent food and plaque and bacteria from getting stuck in the grooves of those teeth. So it's a preventative treatment. It doesn't require numbing, no type of anesthesia. And typically I'd only recommend that on kiddos who are cooperative enough to handle it and who are not super anxious and fussy, because actually placing them and not placing them properly can cause more harm than good. So for kiddos who are super laid back, cooperative, and are able to tolerate having sealants placed, it's a preventative measure on permanent molars typically.
And so, as far as the baby teeth, at what point do those start coming off, and when should I guess, the other teeth start coming in, ideally?
Average age to lose the first baby teeth are the bottom front teeth at 6 years old.
Okay. So I was already an advanced advanced student in the tooth loss.
Right, and so that's why when you lost your teeth at 5, it took a while for them to
Yeah.
come in, because typically I would expect them to start falling out at 6 years old. However, I have 8-year-olds come in who have not lost any teeth and are really, really stressed about it, and I always tell the families, "Don't worry about it," because like I mentioned earlier, dental age and chronological age do not always match up. There are sometimes 8-year-olds who are at a 6-year-old level for their teeth, and again, it's not a big deal at all. It's not going to negatively affect them. They catch up eventually.
Got it. At what point do you start evaluating for whether the wisdom teeth are coming in?
Usually teenage years, late teenage years.
Okay.
Mhm.
For I had wisdom teeth, and I just remember being told by the person that I went to that, oh, yeah, you're gonna need to get rid of them because they're gonna. I forget what he said to me. I was 20, and I was like, sure, get rid of them. But now, as an adult, with realizing I didn't have lateral lower incisors, I'm like, I probably could have had room for for those
Maybe,
lower.
maybe not.
And I'm like,
Maybe,
I
maybe
wish I
not.
had asked more questions at that age. So, what are you looking for in terms of wisdom teeth, whether they get to stay or whether they have to come out?
It all depends on the person. And some of us never develop wisdom teeth. I would say it's a very small percentage of people, but some people are just never develop wisdom teeth and never have to worry about it. Some people develop one wisdom tooth or two or three. But the majority of the time I see people with four wisdom teeth that are impacted. Impacted means that there's not enough room for them to come into the mouth. And the issue with that is that they're not just hanging out in the bone, they're usually at an angle and pushing on the adjacent teeth. And so leaving them could potentially damage the adjacent teeth that they're pushing on.
Got it. And then causing even more issues because then there's obviously
Mhm,
crowding.
mhm,
The other question I want to ask you, because I started with trauma, one of the questions that came up with my audience is, what do you do when your child has dental trauma? Like in my situation, 5 years old, you
mhm.
fall down. What is the next course of action for a parent if the tooth is still attached, or even speak to when the tooth detaches, but it's still their baby teeth?
Yeah, if it's baby teeth and it comes out, in one piece cleanly, there is nothing to do as far as reattachment. It can't be implanted back into the mouth. When it's a permanent tooth and it comes out in one piece, we can reimplant it back into the mouth. And so I would say put it in some milk and run to your dentist as soon as you can, because when it's a permanent tooth, it needs to get back into the mouth within 30 to 60 minutes to be savable, because there's a ligament around the tooth that's been severed, and we don't want the fibers of that ligament to necrose or die and not be able to reattach.
Got it. So within an hour, get out there and get it done.
Get it put back in, and the dentist will put it back in and place a wire to stabilize it for a week or two.
So what is the purpose of the milk?
The milk keeps it moist. We don't want to put it in
Okay.
water because that ruins the ligament.
Oh, got it. Okay.
So it keeps it moist so that the ligament doesn't dry out.
Interesting. Okay. And so, but if it's a baby tooth, you just
You cannot put it back in.
got
Yeah.
it. Okay. Okay. And what about if, like in my situation, and this is probably my memory, what is the course of action when there is actual damage to the gums also at that point? Is there a risk of like the gum receding because of the trauma?
It would depend on that particular situation and how severe, the injury or laceration is. Typically, tissues inside the mouth heal very quickly and are pretty resilient. Occasionally, there may be sutures required, but most of the time, when there's lacerations to the tongue and to the gums, it heals on its own. I would say warm saltwater rinses, cold foods, cold drinks, Tylenol, and Motrin as needed. But of course, visit your dentist so that they can assess the specific situation.
So, other than scaring our children in about getting cavities,
Yeah.
how else can we promote dental hygiene, especially in the younger kiddos who do want to have some autonomy, but obviously are not ready? And I guess my other question is, at what point can they be independent in brushing their teeth? I mean, I'm not going to let my 3-year-old be in charge of the toothbrushing, obviously.
Right. I mean, I really believe brushing should be supervised up until 6 years old, but sometimes with flossing, kids can need help even up to 12, just because they don't necessarily have that dexterity. So I think starting out in those early years, brushing for your child, especially when they're toddlers, and then once they get to that age, like your daughter's age when they're 3, they want to try to start brushing on their own. So I would say you brush first and then let mommy or daddy check afterwards, and also brush to make sure that we didn't miss any sugar bugs that are hiding back there. As far as cavities go, kids don't really understand what cavities are. We just call them sugar bugs. We have sugar bugs. We don't want the sugar bugs to build houses in your teeth. We don't want to leave any food behind for the sugar bugs, because the bugs are germs that leave acid on your teeth and eat up your teeth. And we don't want that. You're too pretty for sugar bugs.
Oh, I like that. Yeah.
Yeah. And that may be motivation.
Cool. Okay. Now we're going to slightly change gears from talking all about teeth to talking about you as a working mom in medicine and especially running your own practice. What are some of the ways you've been able to kind of make that all work out? I'm Shira Bergbauer, and you're listening to an excerpt from the Stethoscopes to Swaddles podcast. You can listen to the whole episode wherever you get your podcasts, and look out for new episodes out every Monday. You're doing a great job, Mama. I'll see you next week. Bye now.